Hi, Mama. Are you looking to start working out again after having a baby? Come along with me and try this workout. All you need is a mat or a place to lay down. And this is safe to start early postpartum. I'm Dr. Carrie Dominic. I'm a pelvic floor physical therapist. I work with a lot of moms during and after pregnancy. And I designed this exercise program based on the exercises I commonly give to my moms. But I don't know you and your medical history, so make sure you get clearance from your doctor or medical provider before starting this program. Let's go. Grab your mat and let's get started. So we're going to start laying down. And this week is really about just getting your body moving. So we're going to start with what I call a pelvic tilt. So you're just going to press your lower back into the ground and then make a little arch with your back. And roll and arch. So I have a lot of motion. You might not look like this. Just do what you can. So I always tell my patients, like, repetition is going to make this better. So don't force it. Nothing should feel painful or uncomfortable, but we're just getting things moving. And at this point, I'm not lifting anything up. I'm just rolling. Let's do two more. Good. And then this time we're going to roll up into a bridge and lift, but I want you to start with this pelvic tilt and keep rolling one segment of your spine at a time until you're about a straight line at the top, and then you're going to roll down one segment at a time. I expect this to be hard. This is hard for most people. Just do your best. So with this, we're getting a little bit of spinal mobility and a little bit of glute and leg strengthening. And if you can't lift this high, then just do what you can. Again, nothing should be painful. It should just feel like movement, maybe a little stiffness, maybe a little weakness, but no pain or discomfort. And if anything hurts, please skip this for now, or do a smaller motion, or do less repetitions. Especially if you're newly postpartum and you're just starting to move, these exercises are safe, but depending on how far postpartum you are, some of these things might be difficult. Very good. Okay, now we're going to work on a little bit of core. And so I want you to think about, I tell my patients to engage their abs. So I'm not sucking it in and I'm not pressing my back down. I'm just sort of like using my abs enough to keep this part of me from moving. And with that, so I'm engaging my abs just enough. And then we're going to do a little marching motion. And so the goal of this is that only my legs move and not anything above my waist. So that's where it becomes a core exercise. And really the goal is control. So again, if you're early postpartum, this might be more challenging. If you're a little further out, this might be pretty easy, but use it as a warm up, use it as a connection of your abs to really focus on what's happening and learn control and get these abdominal muscles working again. If you were recently pregnant, they got stretched out. Let's go one more on each leg. Perfect. Good. And then we're gonna do the same thing. So engage these abs just enough to keep this part from moving. And this time you're gonna slide your legs straight. And then you're gonna come back. I need to scoot up on my mat a little bit. Okay, let's try that again. Slide the legs straight and come up. And then slide the other one straight and come up. So again, if you're a little bit further out and stronger, this might be pretty easy. But if you're newly postpartum, this can be a core exercise too. So again, I'm trying to engage just enough to keep everything still and just my leg moves. And nice and controlled and slow. We're going to go 2 more times on each side. And I just have my hands here because they are. You can have your hands there, it doesn't matter. One more. Good. And this next one we call a bent knee fallout. So again, same position. I'm going to angle myself a little bit so you could see a little bit more. And then you're going to go out to the side with one knee, out to the other side with the other. So again, I'm engaging my core just enough that nothing up above moves. And I'm not letting my knee fall all the way down, trying to keep my hips glued to the ground. And then I'm using my core to control the leg in and out. And so you can see I'm only going about halfway up and down, out to the side and back. Let's go one more on each side. Perfect. And then we're going to stretch a little bit. So I want you to take one knee and hug it to your chest. You can leave the other knee bent, or you can put it flat, whatever you prefer. So just let this relax as much as you can. I feel a little pinching in my hips. I'm just going to try to relax it, see if that goes away. And then switch sides. Again, if you still have a little bit of belly, you can go around your belly, a little angled out, that's fine. Take some deep breaths while you're here. Let's switch legs again. Yeah, so try to move some air through your diaphragm and your belly. And then switch again, other leg. Just notice what you're feeling in your body, what areas might need more love and attention, and what areas are feeling good. And then I want you to take both knees and hug them to your chest if you can. And again, if you still have a belly, you can open them up a little bit. Try to let your legs relax and be heavy if that feels comfortable. Try to take some deep breaths. Good. I'm going to put my legs down and we're going to do a figure 4 stretch. So crossing one ankle over the other knee. Let me angle myself a little bit again to show you. And then if you need more of a stretch, you can take your hands under your opposite thigh and hug that to your chest. But if that's too much, you can leave it down. You can even push this knee away a little bit. All of those are good ways to do this stretch. It just depends on your flexibility and where you feel the most stretch. So you should feel the stretch, the leg that's crossed, in the back side of that. Okay, and then switch legs. So you can push away if you want. You can hug to your chest if you need more stretch. Whatever feels the best for you. Good, and let's switch. Let's do that one more time on each side. push it away or hug it to your chest, whatever you need. And then switch legs one more time. Good. And then I'm still going to keep myself angled a little bit to show you. This time we're going to let our lower back stretch and we're going to let the knees come all the way over if that's comfortable. So this time we're letting everything go. And then we're going to go to the other side. And then back. We're going to go nice and slow a few times back and forth. Switch. So if it feels uncomfortable, you don't have to go all the way down. But if you can, you could go all the way down. Let's go 2 more times to each side. Again, hopefully each repetition you feel a little more mobility, a little less stiffness, but don't force anything. Just the repetition of it should improve over time. And we're going to end with that for today. How did that feel? I hope you enjoyed it. And if you like that and you want more, check out my 4-week postpartum Foundations of Fitness exercise program. And it's exactly like this, but you'll get 3 videos a week that are around 10 minutes or so, like this video. But you'll get 1 upper body, 1 lower body, and 1 core exercise video each week for 4 weeks, and this should set you up for a great recovery and to go on and to do other more challenging, more intense exercise without injuring yourself. I will link it in the notes below.